All right, you ever looked in the mirror and felt like you look just sad or tired, even though you've had a full night's sleep, or kind of have like droopy, sad, like puppy dog eyes? Both of those things are reasons that people come in and see me for lower lid blepharoplasty or lower eyelid lifts. Today, we're going to talk all about them. So stay tuned and we'll get answers to your questions here coming up soon. All right, welcome to the Trillium Show, where each week we discuss different tips to help you improve your mind, your body, and your life. I'm your host, board certified plastic surgeon and medical director of Trillium Surgery and Trillium Aesthetics. All right, so welcome to the Trillium Show, where each week we discuss different tips to help you improve your mind, your body, and your life. I'm your host, board certified plastic surgeon and medical director of Trillium Plastic Surgery and Trillium Aesthetics, Dr. Jason Hall. So, lower lid blepharoplasty is one of these operations that a lot of people come in asking about. They want lower lid bags removed. They don't like the crepiness or the crinkliness of their lower eyelid skin. So lower lid blepharoplasty is often a thing that we talk about to help improve that. In this show, what we're going to do is kind of go through lower lid blepharoplasty from soup to nuts. And you can tell it's kind of hard to say. Blepharoplasty, eyelid lift. So what are the goals? Because it's important before we start talking about treatments to understand what the goals are. Goals of a lower lid blepharoplasty are threefold. One is to get rid of the sad, tired puppy dog eye look. Number two is to remove or smooth excess wrinkly skin. Number three is to remove and contour the hollow that develops in our lower eyes with time. But just as important as it is to know what things can do, it's important to know what things can't do. So what doesn't a lower lid blepharoplasty do? Well, first of all, while it eliminates some of the crinkliness under your eyelids, it doesn't eliminate all of it, and certainly doesn't eliminate wrinkles and crow's feet out to the sides. Those are things like Botox and Jeuveau and Dysport will still be needed to really get rid of those crow's feet. The other thing that it won't do is it won't take away completely the dark circles. Now, we could do a whole nother show about dark circles under the eyes and what causes those. But a lot of times people get pigment that gets deposited here in the lower eyelid that occurs over time. A lower lid blepharoplasty will not address that by itself. Now, there are other things that we can do with our lower lid blepharoplasty, but a blepharoplasty itself won't get rid of the dark circles 100% and the pigment that's under the eyes. Now, it's really important when we talk about lower eyelid surgery to understand why we're seeing what we're seeing. And if you've listened to my facial aging podcast, which we'll link right up here, the facial aging happens as a result of three main components: skin changes, volume loss, and then gravity. The volume loss is something that around the eyes shows up typically, different strokes for different folks. Typically start seeing that late 30s, early 40s, and is what contributes to that tear trough or that eyelid hollow. Some people it happens much earlier. Some people have them their whole lives because of the way that their eye sockets, their facial skeleton are put together. But it's important, and one of the things that has really changed in lower blepharoplasty surgery since I've been in training and learned how to do this, 15 years ago, was we now know that volume replacement is just as important as volume removal. The bag that you see under your lower eyelid really is the result of the covering of some fat that's in your eye weakening, and that causes that lower eyelid fat to protrude out and be a little bit more prominent. At the same time, we lose volume in our cheeks overlying it. And so a good analogy for this is it's like the tide going out at the beach. That volume loss is like the tide going out and exposes the stuff that's underneath. And so bringing the tide back, replacing some of that volume, is really important to help smooth the contour between your cheek and your lower eyelid. And so anymore, every single lower blepharoplasty that I do, we talk about bringing some fat back into the upper cheek to help soften that transition between the lid and the cheek. The other thing that has really changed a lot since I learned how to do this is that the concept of kind of opening everything up and really weakening the lower eyelid has largely been replaced with non-invasive or less invasive approaches where we go in through the inside of the lower eyelid and we avoid the support that is in the lower eyelid. And we'll talk about that here in just a second. That improves, but by avoiding that, we still have to address the skin of the lower eyelid. And I do that now in two ways. I either use what's called a skin pinch, where we just do exactly what it sounds like, remove a little pinch of skin at the end of the procedure. Or what I do most of the time now is use a laser to help resurface that under eyelid skin. And that is by far the most common thing that I do, and we'll get into that here in just a second. So what does a lower blepharoplasty procedure look like? So most of mine are transconjunctal, or going in through the inside, and that's a hard word to say, transconjunctival. So go in through the inside and then contour some of that delicate fat that sits underneath your lower eyelid. Once that is done, then on the outside, we'll either take a little skin pinch through a little incision right underneath your eyelashes that hides beautifully, or we'll use a laser to help resurface that lower lid skin. At the same time, we'll use some fat and inject some fat. Take a little bit of fat from your abdomen, take a little fat from your thighs, and inject that in to fill in some of that hollow. The final thing, and I'm very conservative in doing this, is using what's called canthal support. So supporting your lower eyelid and the corner of your eye, which is less a cosmetic thing. If you really think about it, we're not really changing the shape of your lower eyelid. What we're doing is helping to kind of tighten that lower lid, which tends to get loose over time, and prevent it from dragging down. You've seen people who have had lower lids that kind of walk around like this. Not a good look and very, very difficult to treat. So kind of like most things we talk about in facial surgery, ounce of prevention is worth a pound of cure. And so what's called a canthopexy, or a little suture that helps to tighten that from the inside, is used a lot in lower lid surgery. In terms of recovery, really swelling for lower lid surgery is the main issue. Typically, like most facial surgeries, I recommend people kind of hide out for about 2 weeks to make sure that swelling is gone. If there's a little bit of bruising, a lot of that stuff we can treat with a laser here in the office right after surgery. And for the fat grafting, the fat transfer, especially in patients who have very thin skin, that swelling under the eye can be noticeable for about 6 weeks. And that's why I have people, I just tell patients, pause your workouts for about 6 weeks, because the more you exercise, the more you get your heart rate up, your head sees a lot of that blood flow, you're going to worsen your swelling and make it stay around even longer. The other question we get, especially with lower lid surgeries, for people who wear contacts, you want to avoid contacts for about 10 days after the surgery is over. We don't want to lose a contact in an incision. That's a big problem. Never had it happen, but we don't want you to be the first person. So what other procedures can we do with a lower lid blepharoplasty? Well, pretty much any facial surgery can be done at the same time we do a lower lid blepharoplasty. It's very oftentimes combined with brow lift and upper blepharoplasty surgery. Because we've got the laser out and are using it, we will often do full face laser resurfacing to varying depths, depending on kind of what skin problems we're looking to treat. And a lot of times a deep plane face and neck lift is done in conjunction with our lower lid blepharoplasty surgery. A few things to watch out for. If you've ever had filler in your under eyes, and tear trough filler is really common these days. If you've ever had filler in your under eyes, we have to know about that on the front end so that we can dissolve it first. Under eye filler and surgery doesn't typically go well because of swelling. You can have that filler tends to obstruct the fluid drainage, the lymphatic channels under your eyes, and can cause prolonged swelling. So if you've got filler under your eyes, it's important that we know about that so we can dissolve it before surgery. It's also important so we know kind of what we're dealing with in terms of volume replacement before surgery. If you have dry eyes, lower lid blepharoplasty surgery will make this worse, at least temporarily. And if you've got really dry eyes, that it could even be something that will make lower lid blepharoplasty surgery not something we want to deal with. So it's important to kind of we talk through this before surgery. The other thing that can happen after surgery is something called chemosis, which is swelling of the white part of your eyeball itself. It's benign, but it can be a pain in the butt and needs to be treated. So we have some steroid eye drops. Sometimes we'll have to patch for a couple of days to get that swelling to go down. And if it's really severe, we actually need to drain that fluid out in the office, which sounds horrible, but really isn't. We just put a little numbing drop in, make a little snip in the covering, heals uneventfully, but that's kind of a last ditch effort. The other thing that can happen, you can have some subconjunctival hemorrhage. So in the white part of your eye, you can get a little bit of bleeding. Doesn't happen often. It's impressive looking, but isn't because that part of your eye turns red, but isn't dangerous. So speaking of dangerous, can't talk about surgery without talking about complications. What's the worst possible thing that can happen? You could go blind. Now, this is exceedingly rare. The quoted rate is 1 in 10,000. It's probably even more rare than that, to the point that most of us who do this have never seen that, knock wood. Eyelid malposition is the other big problem. Your lower lid getting dragged down by the swelling after surgery. That's a reason for doing the transconjunctival approach. So we're staying away from the support. It's also a reason that we use canthopexy sutures routinely to help support that and prevent that malposition. Corneal abrasions are another issue. Those are really rare, kind of eye scratchy. You have eye shields in during surgery to protect your eyes, but you can get a little scratch, which is painful, but heals without issue. And then obviously with any surgery, there's a chance that things couldn't look exactly like we want them to, and we would have to go back and revise that. So this has been lower lid blepharoplasty in a nutshell. I hope this gives you good information kind of about how the procedure works, what types of things that this can treat, and more importantly, what types of things it can't treat. So thank you for listening. I would recommend everybody go back and look at the facial aging show that I did. It is a good resource if you're contemplating any facial rejuvenation surgery to kind of know why you're seeing what you're seeing first. But thanks for listening. If you enjoy the show, please leave me a review on Apple Podcasts. Please comment down below. If you have an idea you'd like to see made into a show, or have a question you want answered, send me an email, media@drjasonhall.com. Drop me a DM on Instagram or X @drjasonhall. Thanks again, and we'll see you guys soon.